Hi, it's Christophe Clugston. Some of you know me as an academic linguist who's done linguistics and language learning videos. Others of you know me as a professional fighter. Others of you know me from the self-defense field and being a subject matter expert for militaries and contractors. And some of you other people may know me as a dog trainer and seeing my dog videos. Well, I'm coming to you today with a totally different subject, something that I've been meaning to do for quite a while. And that's because I'm in a unique position as someone who's gone through this surgery twice. And that surgery is a hip resurfacing. And then what is hip resurfacing? It was when you have damage to your acetabulum and to the condyle, the top of your femur, that needs replacement, generally through arthritic reasons. There's some other reasons, but that's the main reason. Now, a lot of people in the United States are told that they have to have a total hip replacement because surgeons don't have the skill to do the surgery for resurfacing. It's the difference between a normal orthopedic surgeon is like a Cessna pilot compared to what you need as an F-18 fighter pilot to do the resurfacing. And there are 3 people in the United States that have impeccable qualifications, and that is Dr. Pritchett, who's in Seattle, and then there's Dr. Sue in New York City, Manhattan. He does all the celebrities and a bunch of professional athletes, because this is the only way to go back to professional athletics after this surgery. And there is also Dr. Gross in South Carolina. In the United States now, in Europe and in Asia, there are others, and I've gone to one. My very first one, I've had both hips done. First hip was done in 2010, at the very end of 2010, almost 2011, and that was done by Dr. Bose, who I really like. He's a great guy. And I had that done in India. Because if you follow me, you know that I lived in Southeast Asia for an incredibly long period of time. So I had that done, and I'll cover that a little bit, but let me jump just to get this out of the way. And then I had my other hip done in the almost the end of 2022 by Dr. Gross in South Carolina. And the changes that have happened, in India, it was in the hospital. I was in the hospital. I was treated as a VIP. It was a lot of things that made it much easier to do it this way. Everything was included. Everything was done. All the testing was done in the hospital when I got to India. Everything was done the 2 days before the surgery, and then I had the surgery, and then I stayed there in the hospital for 2 days, and then I stayed in India for a week to be good enough to fly, and that just means that I had to be able to move easily. So that entire experience was great. There's a lot of benefits to being in the hospital after the surgery, because you are weak, and I mean incredibly weak, and in those hospital beds you have ways to pull yourself up and move yourself around and use buttons to lift things that you don't think about in a normal bed, and you can be trapped in a normal bed. It's incredibly debilitating. So that was my experience there. Now, when I had it done in South Carolina, this was an outpatient surgery. This is how much they've evolved this, and the volume of numbers. So Gross now is the #1 leading guy in the world, actually, with the sheer numbers. He's way over 7,000 surgeries that he's done. That's who you need. You need people who've done it. And when I saw Dr. Bose, he was in the top 5 in the world, and they're both in the top 5 in the world right now. Gross and Bose are still both in the top 5 in the world. Now, in the United States, there are 3 people to see, and one is Dr. Pritchett in Seattle, Dr. Sue in New York City, who handles all the celebrities and also professional athletes. He did the Big Show, the wrestler, the guy's huge, right? He did one of his hips, and he's done some hockey players and some other people that were professional athletes. The only way to go back to professional sports is with a resurfacing. Now, I want to jump to this. I'm jumping around a little bit because it's such an involved topic, and I don't want to talk for an hour. The hip resurfacing is done only by surgeons who have a lot of experience, a lot of skill. They have to go through. It's a much more involved, technically hard, difficult surgery than a total hip replacement. Total hip replacement is done because the Walmart type of orthopedic surgeon who covers everything, who does shoulders, knees, hips, everything. He does everything. He'll do that because there's a lot more room for error. It's much easier to do it, and people are just told, well, we can't do anything for you. That is not true. You need to go to a specialist. And like I'm telling you, unless Sue Pritchett and Gross has said, hey, we can't resurface you, you can be resurfaced. And the reasons to do resurfacing, if you ever want to jump, run, kick, do martial arts, do any professional sports, skydive, it's the only way to do it. A total hip resurfacing is the only way to do that. Now, if you have the whole hip replaced, where it's a metal stem which is jammed down inside of your femur, and they cut off the top of your femur and put in it, and lots of different types of. There's a ceramic ball, there's a metal ball, there's a composite plastic ball, and then the cup that it fits in the acetabulum, that can be very different. Well, now the only thing that allows you to really go back is to have the top within resurfacing, just the top of the femur is cut. You have a new cap put on, and in the acetabulum there's a cup put into that, and it's metal on metal. In most every case, Pritchett uses a composite plastic here that's a new generation plastic for this part. But barring that, metal on metal, now people can say, well, there's ions and this and that. Nothing has been traced to any problems. And with the people who've done so many now, they know the correct angles to put them at. The failure rate is lower with resurfacing. It has longer longevity, and you can do things that you just cannot do with having a total hip replacement. Total hip replacement means you're taking forces through that stem down into your leg. Is not the way that you're geometrically lined up to take forces from nature. You cannot take pounding. That's where the ceramic balls may be nice to get through the airport because it doesn't set off the detectors, but those are very brittle. They will crack with impact, whereas the metal on metal does not. So the thing is here, I want to explain that yes, going through one surgery in India, which I liked much better. I think that surgery was pretty textbook for him there. The one I had in the United States, I was in a far worse shape than they thought, far worse shape than the x-rays showed. Until he got in there, he didn't see how badly it was, and he's probably the only surgeon, Dr. Gross, who would have continued on. I had to be very careful for 6 months not to do something that would damage that hip as it heals. Now, the difference is I have in my one side, I have a Birmingham, which is the most used resurfacing prosthesis that there is. It's arthroplasty is what the name of these things are. When you have the prosthesis and the cup is a Birmingham, the other one is a Biomet. They're similar, slight differences. Geometry is a little bit different. The approach, they both use a posterior approach for the initial cut to open you up. Things got to be cut. There's no way to do any sort of joint in any of your joints without cutting something, and then it repairs. Now, if you knew me way back, you know that my right leg was my main leg in fighting. I had higher flexibility in my right leg. Well, the recovery with the Birmingham, I lost some flexibility, and in the left, which is the Biomet side, I have not, which is strange. I don't know if it's a slight difference in the positioning of the cut and in the healing process, but my flexibility is exactly the same at this point with the left as it was before the surgery. My right is not. I'm trying to work on that now because I can balance them both out, because when my right was done, my left was starting to go bad, and then it went bad, obviously. There is a big gap, as I'm saying, in the time periods of when I had them done, and as I'm saying, it's now an outpatient surgery. It's amazing. I went in, and in the morning, I had surgery. I was like number 4 or 5 for the day. He does a lot of surgeries. That's what you want, someone who knows what they're doing, who doesn't do it sometimes. Ask a surgeon if you consider resurfacing. Talk to the surgeon and say, how many have you done? How many do you do? And the ones who are good, and there's a way to find out who's good and who's not, who's done the most. Anyway, if you stick with Pritchett, or Gross, and if you got to pay like I did, just cash, it's worth it, because this is your life, what you're going to be able to do further down the line. Because with a total hip replacement, you can't run, you can't jump, you can't do sports at all, and it's going to wear out too eventually, depending on what age group you have it in. That's another thing too. Resurfacing is better for younger people because it lasts longer. It doesn't need to be replaced, and the total hip does. And you cannot do certain motions. You cannot move your leg. You can't do oblique motions. You can't cut and juke and jive, as we would say in certain sports. You can't do that. It will dislocate. Now, there's different ways to put in a total hip replacement, but the factor is that you're just dealing with things that are not anatomically correct for your own body. And when you resurface, all the angles are for your own body, idiosyncratically perfect for your body, which is totally different than trying to stick a stem in with a ball on it and then a cap that is not made for you. It's just made like a production line thing. So anyway, what I have to say about this is that I had 2 different surgeons, both tops in the world, and where do I think was a better experience? I say overall India. I just like Dr. Bose a great deal. He's a funny guy. And the treatment that I got there and everything done and everything encapsulated at one time. I didn't have to, in the United States, I had to go get testing one place. I had to do blood tests here and x-rays here. All these other things, pre-surgery stuff, all done somewhere else, and then coalesced and sent to them in South Carolina, which is a mess. Where in India, I just went to India and did everything right there in the hospital. There was no back and forth. I will say that in India I was under general anesthesia, which I don't like, and in South Carolina I was under regional and also the memory drug, where you don't remember what you went through. I was regional. I had a spinal block, and I was also under regional, and then of course the memory wipe drug, so that you don't end up with PTSD. Anyway, so those, what can I say to people? I say to people now, don't get a total hip replacement until you've talked to the top people as a specialist in resurfacing. If you care about what you're going to do, if you're active, and I'm not talking about golf. You know, oh, I went back to golf. That's not a sport to me. That's not an active life, you know. But if you're talking, if you came from running and jumping, doing tennis, any movement, any kinetic stuff, if you were a fighter, obviously, hockey player, wrestler, you have to do resurfacing. Otherwise, you're done. It's over with. Everything is done. I know people who were athletes and then they did a total hip replacement. It's over with. They can't do anything, and then some of them have tried to force their way through, and they dislocate things. Also, if you're lifting weights, you'll never be able to lift weights again if you have a total hip replacement. You can't squat, you can't deadlift, you can't angle, you can't do the 45-degree angle incline leg press. You can't do any of that stuff. So if you're fine with being a nobody and you're not an athlete, and all you want to do is walk, because the pain is huge if you really have arthritis in the hips. And I was bone on both sides, and I mean, I have a high tolerance to pain. We won't go into that right now, but I have been massive. I've impressed a lot of surgeons by how much pain I can take. I wish there was some prize for that. But anyway, so I've had the Biomat and I've had the Birmingham, both of them. I've had a top surgeon in India, which is another place you want to go for surgeries, because they just specialize and they're very good at what they're doing. and I had a top guy in the United States. Now, so there's my recommendations. Do not get a total hip replacement until you've talked to a specialist who has done more than 1,000, minimum 1,000 surgeries of resurfacing. Otherwise, you're talking to someone who's still learning. And that's just how it is, you know. Nothing against it. There's a learning curve, but you want somebody who's done a lot. And so thanks for listening. There's my public service announcement for people who are going through hip problems.